You know what's cool about Dr. Clint Muench? We were just having lunch, and as we were getting served, two of his patients walked by. And I feel like wherever Clint goes, he is the king of knee and hip replacement surgery in Minneapolis and the Twin Cities area. How many hip and knee replacements have you done?
Oh my gosh. I do probably 200 knee replacements and probably half that number of hip replacements per year at this point in my career. And I've been doing it for 25 years.
So if we do the math on that, that's thousands of knee and hip replacements.
Yeah.
What was it like doing your very first knee or hip replacement?
It's a little bit scary when you first start. When you're a resident, you only get to do a small part of the procedure, so your role is very small. By the end of the training program, you've done hundreds, so then when you get out into your own practice, you're skilled, you're well trained in what you're doing.
So if I was looking for someone to do a knee or hip replacement for me, how would I be able to tell that they're a good surgeon?
That's a great question. So I think the one question that people almost never ask is, do you do a lot of these? Or how many of these do you do a year? And I think you should ask your surgeon that. If they do one or two a year, you better be careful. If that's what they do every day, if that's what they're doing hundreds of times per year, that's the first thing you want.
Yeah, awesome. How do you become like the guy for knee and hip replacement?
I'm old. When you've done it for a long time, I do think that's true. Like your patient practice kind of ages with you as you get older. When you're a younger surgeon, you take care of young people that don't really need joint replacement. They're getting knee scopes or shoulder or rotator cuff repair. But as you get older, then your patients age with you. And so since I'm old, my patients are old and they need joint replacement.
Do you think there's going to be a day when you need a joint replacement yourself?
Gosh. I think about that. I have a short list of surgeries that I hope to never have to have, and knee replacement is one of them. In part because the recovery is so hard. I wish there were changes in the way that we do things that make the recovery a lot easier. It's already one of the most successful surgeries you can have, and if it were easy to recover from it would be even more successful. But yeah,
a good surgeon makes recovery easier.
I think it helps. I mean, and it's not just a surgeon. I have a huge team of people that make our outcomes as good as they are.
Fantastic. Now, your wife Michelle is also a surgeon?
She is. She's an ophthalmologist. Yeah.
And your son is about to become a surgeon.
Well, he wants to be.
Maybe.
He wants to be. We'll see. He's got a ways to go in his training to make that happen. But yeah, actually, two of them are on that track, and the third one might be also. We'll see.
Yeah. What's the thing that gives you energy?
Oh, that's a great question. I love that. Outcomes. Successful outcomes. When you see someone like those patients we saw at the restaurant, and they come up to you and say, "Oh my gosh, my knee feels so much better than it did a year ago when you did my knee replacement." I've been able to hike now, and I can keep up with my spouse. That's what gets me out of bed.
That's got to be awesome. Wherever you go, you run into these patients and tell you how they're able to move around and enjoy life.
It's fun. It's a small town. It's a small community, and that has its ups and downs. Obviously, I run into my patients all the time, and so I love it. It's great.
Fantastic. Well, it's a pleasure hanging out. Thank you, Dr. Clint.
Thank you. I appreciate it.
Dr. Clint Muench. If you could spell that, you can represent California in the spelling bee like I did in 1988. All right.